As at 9 o'clock this morning, there have now been 10,721 positive cases confirmed. That's an increase of 200 from yesterday. A total of 1,754 patients are in hospital with confirmed or suspected COVID-19. That is a decrease of 8 from yesterday. A total of 126 people last night were in intensive care with confirmed or suspected cases of the virus, and that is also a decrease of 8 since the figures I reported to you yesterday. These figures do, as I've said over the last few days, continue to give us cause for cautious optimism. I'm also able to confirm today the positive news that since the 5th of March, a total of 2,448 patients who had tested positive for the virus have now been able to leave hospital having recovered from it, and we all, I'm sure, wish all of them well. On a much sadder note, I have to report that in the last 24 hours, 70 deaths have been registered of patients who had been confirmed through a test as having COVID-19. That takes the total number of deaths in Scotland under that measurement to 1,332. The second issue I want to address today is relevant to everybody watching at home, and it relates to face coverings, an issue which has attracted lots of attention recently. Guidance on this issue has just been published on the Scottish Government's website, and I want to tell you today what that guidance says. Before I do, though, I want to stress at the outset a very important point and ask you to bear this in mind. I'm talking here about face coverings made of cloth or other textiles, such as a scarf. I'm not talking about medical grade face masks that you would see health and social care workers wearing. The guidance that we are publishing today firstly makes clear that the most important step we can all take to prevent transmission of the virus is to comply with the current stay-at-home, social distancing and hygiene rules. Face coverings are not, I repeat, not a substitute for any of that. The guidance also makes clear that the evidence on the use of face coverings is still limited. However, it recognises that there may be some benefit in wearing a face covering if you leave the house and enter an enclosed space where you will come into contact with multiple people and safe social distancing is difficult. For example, on public transport or